Or welcome. So hi everyone, again, welcome. My name is Mabel Shu and I'm part of the SIFPAC support team. Welcome to the first day of our 2025 Fall Supplier Development Summit hosted by the GFPI team, Good Food Purchasing Initiative team. Today, with our partners, we're looking to make Chicagoland's food system more equitable and transparent, centered on food that is local, sustainable, fair, humane, and nutritious. And that means shifting how institutions buy food through the Good Food Purchasing Program, as well as uplifting suppliers and food businesses with resources and gatherings like this summit. Thank you for joining today's session, which is partnering with healthcare, opportunities for food vendors in medically tailored grocery programs and institutional procurement. And we have a lovely panel today featuring Jennifer Marsison, Stephanie Fulkins, Erica Block, and AK Crit. So I'm gonna hand over the floor to Jennifer.
Thank you. Good afternoon, everyone. My name is Jennifer Marsison, and I serve as the Director of Health and Healthcare at Westside United. I'm so grateful to be your moderator for today's panel. At Westside United, our mission is to support Westside community members in achieving health and wellness through two key impact areas: Live Healthy Westside and Thrive Westside. Live Healthy Westside focuses on reducing health inequities by coordinating interventions with healthcare and community partners to better align local needs. Our team will implement strategies that promote hypertension management, maternal and child health equity, and nutrition security, all grounded in community engagement and data-driven collaboration. Our second pillar, Thrive Westside, is centered on economic vitality and community-led development, and we work to ensure community vision drives investment by leveraging collective buying, hiring, and investing power of our hospital and anchor institution partners. Each year, the hospitals and anchor partners collectively will spend $5 billion on goods and services, from supplies to maintenance and marketing. And through our local procurement initiative at Westside United, we aim to shift a portion of that institutional spending to businesses within our 10 priority Westside communities, helping to strengthen local economies and create lasting opportunity. Since Westside United's launch in 2018, our anchor partners have spent more than $257 million with local vendors, demonstrating the power of collective collaboration to drive meaningful, measurable impact. And I'm excited to further talk about these themes in today's panel. And to start with, I'd like to invite the rest of the panelists to introduce themselves, starting with Stephanie Fulkins.
Hi, I'm Stephanie Fulkins with Ann and Robert H. Lurie Children's Hospital of Chicago, and I'll be talking a little bit today about some of our family food programs, our medically tailored grocery programs, and I will go ahead and pass it to AK.
Hey everyone, I'm AK Crit. I am the Community Nutrition Manager at Swedish Hospital, which is part of Endeavor Health. I oversee both of our community nutrition teams as well as patient navigation that connects patients to resources, including food. And I'll pass it to Erica.
Good afternoon. My name is Erica Block. I'm the Senior Director of Food Nutrition Services at Rush University Medical Center and Rush Oak Park Hospital, and I oversee the institutional procurement and purchasing for food for our patients, our retail, catering locations on campus.
Great. And to start a discussion, I'd love to just dig in a little deeper into the work that's happening on the ground. So can each of you tell us a little bit more about the programs and initiatives where local procurement has had a key focus?
Jump in. So at Swedish Hospital, we tap into local procurement in multiple different facets. I also, I guess, didn't mention in my intro, but I also manage or run our Green Committee. So that is a lot of where the focus for local purchasing comes from, as well as our Food as Medicine programs. Our Food as Medicine programs include a Veggies for Health program where we purchase produce from Top Box Foods for 8 weeks, talk about incorporating that into folks' diets, how to cook it, how to use it, everything like that. We also have cupboards, which are no questions asked pantries throughout the hospital, where we're purchasing produce for that through 40 acres. And then also have two on-site farmers markets. One that is for the community for anybody to purchase. The other one is located within our hospital walls, where food service is actually purchasing that produce. And then anything not sold to patients or community members is used in the cafeteria the next day. So having a little bit more of a circular economy that way. Sure, we have more that will come up, but the Green Committee is where, I guess, from an institutional purchasing standpoint, we also have a focus that way from our Green Committee on purchasing in the cafeteria as well, which is a little bit less of my area, but I could also speak to as well. I could pass it down the line to Stephanie.
Yeah, so we are not quite as expansive, but we are focused on our family food program is where we are doing some local procurement also with Top Box Foods, our fabulous partner, but we're really hoping to grow and expand that program, including some more vendors. So it depends on where in the hospital the family food programming is happening, but we do have several on-site pantries. One of them is supplied by the Greater Chicago Food Depository, and then the rest are supplied by Top Box. And these are opportunities for families, if they're screening positive for food insecurity, to have a shelf-stable bag of food that they can bring home with them that day. The next level up from there is we have our family food home delivery program. So some families may also be eligible to get a month of weekly deliveries from Top Box Foods. This is a larger box. It includes proteins, dairies, fresh produce, and whole grains, and we're glad to be able to get it directly to their houses as well. And then we start to get into our more medically tailored programming. And so a good example of this is the partnership we have with our nephrology team. So kiddos who are waiting for a transplant in their kidney and or on dialysis, getting ready for transplant, are able to receive up to 12 months of medically tailored food. This is especially helpful because there's some pretty strict dietary limitations when patients are experiencing end-stage kidney disease. So we have to be very careful about potassium, phosphorus, sodium, and a few other elements as well. And then after transplant, they're able to get 6 additional months of the medically tailored boxes that we work with the nephrologists and the dietitians on. And the goal of this box is to start introducing new foods. Since the diet is so restrictive before transplant, we think it's a great opportunity to kind of rebuild some habits, introduce new foods. And so the medically tailored boxes are designed to do all of that. So that's primarily where our focus has been on the procurement side right now. And I'll go ahead and send it over to Erica.
So while Rush does a lot in the community space, my focus is actually on the patient menus, the retail and catering offerings actually that we're serving to our employees and our visitors on campus. So of course, we're still focusing on where we can purchase local, where we can hire local, where we can partner with local vendors, and moving that needle on our GFPP journey. So we were able to sign on to the Good Food Purchasing Program and the Cool Food Pledge back in 2022. So continuing to move the needle on that, we've been able to get great partnership with Common Market and bringing in local dairy from Lamar Dairy. We've been able to bring in Cahokia rice from Southern Illinois. We've been able to partner with Tenatsan Foods right in Chicago and add tamales and chili rellenos to our patient menu. So continuing to look at where we can move that needle and be hyper local in the community, buying local coffee from Ribby Coffee for our brand new robotic coffee machine at our Oak Park campus. So just continuing to see where we can partner and move that needle.
Great. Thank you all for sharing. Inspiring to hear where you're building out local partnerships and trying to embed it more into your work. maybe each of you could walk through how you're selecting vendors for your various programs and what strategies have helped those partnerships be sustainable.
I can start on this one. For us, we're philanthropically driven on our team, so a lot of it comes down to co-authoring grants with different community partners to try and get the dollars in the door. We've also tried to focus on vendors who are able to provide the boxes without having to take a credit card from families or a form of payment. We also look at like delivery capacity, what zip codes are covered. Are they just Chicago? Are they just West Side? Could they go countywide? And then it kind of depends on the scope of the project as well. I think we're going to get into it later, but it can be a lengthy process to become a new vendor. And so if it's a smaller boxes, just a few months or a few patients, we'll probably go with an existing vendor that we have. But if it's something larger, it could be worth bringing on a new vendor for.
I'll jump in next. Similar to Stephanie, also we are a little bit more internally funded. So obviously it also benefits to go for grants as well. We do need supportive funding there. But a real focus on flexibility in delivery days, times, able to get it. Most of our programs happen on our campus here. We do have one delivery program with Topbox that's going to actually employees, it's Veggies at Work. So we partner with Topbox to get produce to our staff, our nurses especially, but everything else happens on site. So we're partnering with our patient food services to store the produce in their very busy kitchen. So having flexibility in delivery days that can fit with their schedule, can stagger deliveries and not have it all at once, has been really helpful, as well as potentially delivering day of programs so we don't have to store it. For example, Veggies for Health is on Thursdays, so ideally getting the produce directly delivered on that day to those patients has really helped with finding vendors. The other end of this, and I did ask our patient food services team as well, any insight from their local purchasing end, but just knowing that the vendors exist, I think is a big part of it, and that came from them as well. I have history in the urban ag space, having done Windy City Harvest program and coming from the ag world. So, and being in these SIFPAC meetings, being in this community, I think the community nutrition end of it, we're a little bit more tapped into what local vendors exist, what local organizations exist. But that's not necessarily the case on the procurement end. So really getting your name out there, being in the same space as healthcare leaders. So they recommended going to conferences or going to vending events where you might meet folks who work in healthcare. Just letting them know that you even exist is kind of equally important to then get into the door.
So in the institutional hospital side, we start with looking at our group purchasing organization. So what are they carrying and what are we able to get this local through that program? If there is nothing local in that area or in that particular food category that we're looking at, we look at our distributor, our primary distributor, our secondary distributor. What are they offering? When we're meeting with manufacturers, we're constantly asking now, does it click the boxes is it considered local within our definition? Is it meeting criteria for sustainability certifications? And then we're also partnering with aggregators like Common Market and Midwest Foods to help us continue to be able to offer local on our patient menu. We do scratch cooking in our patient menu, so we're looking at the basic ingredients to produce our recipes.
And I think just building on this, AK, you touched on this a bit, but just when you're looking for the community members and small businesses that are interested in working with hospitals, What do you look for when you're bringing on new vendors, and how can local businesses be best positioned to meet those requirements?
Yeah, I guess I did say the flexibility in delivery model is, I'd say, the biggest for us. And then also how you're set up to receive payments. Being a hospital system, we have to, it's a little bit of a complicated process. I think Stephanie alluded to this too, but getting you into our system as a vendor takes a bit of time, and then does require payment through invoices and checks. So making sure, this is especially on the food as medicine side, that you're able to kind of be flexible and have time with getting those payments. And we're, on top of it, we're as fast as we can, but it's not immediate. So being a little bit flexible on delivery time and payment as well.
The other thing that's helpful for us too is to understand, like, we run on mostly home delivery, but getting a sense of what's the delivery success rate and what supports are available to coordinate that delivery with families. Something we've really appreciated about TopBox is their customer service team, so that hasn't had to fall to our team. We're a team of 3 awesome people internally, but we're not able to contact all the patients to coordinate delivery days and what to do if someone's not home. So that's been a big reason, like why we selected TopBox, why we continue to work with TopBox. And then Erica, I don't know if you see the chat, but I feel like there's a good question for you from Greg in the chat on the food safety requirements for growers.
Yeah, so oftentimes we don't purchase directly from a farm because there's a lot of requirements involved in ensuring that that food's going to meet the reputable standards for us to be serving it to patients that are, for example, immunocompromised. So that's why it's great for those local farms to get connected with aggregators like Common Market or Midwest Foods, who can help them make sure they have the HACCP program, they have the liability insurance, they have the proper certifications to then be able to be served in the hospital setting. They also will help with logistics, getting the food from that farm to the hospital. Oftentimes there's not the trucks and transportation. The farm doesn't have that, but the aggregator can help them with that. Dot Foods is a great example of, local restaurants and local businesses being able to get their products into facilities, not only hospitals, but restaurants. On a small scale. And then once they get to enough volume, then a distributor can carry them in the distribution warehouses. So just partnering with those aggregators is a great way to get started.
And I guess expansion around food safety, but with many of these initiatives tied to health outcomes, are your vendors expected to have any specific dietary or nutrition guidelines? And Stephanie shared a little bit about the kidney transplant program, but are there any additional guidance you have?
On our end, I think it's just availability of products. We've got the team and the clinical expertise to figure out what items would be permissible and what items would not. So having a variety is super helpful. A lot of produce is fair game though, so we haven't run into it a ton on the produce side. And then I've been appreciative when partners are like, I don't need the list of everything approved, but tell me what's not approved. And that allows them to be more flexible with the boxes, purchase more seasonally. So we've also tried to work on that, like come up with a short list of not approved things. So there's more fluidity. But yeah, we don't necessarily need the medical expertise to reside with the vendors. That's something we can help bring to the partnership too.
Yeah, I would second that. The only area that we are tailoring a little bit is the the food bags at discharge, which is a partnership with Nourishing Hope. So Nourishing Hope provides us with bags of non-perishable food items that go to patients who screen positive for food insecurity at bedside, and they are able to take those bags of food home with them. Because of our population, we just have a blanket no pork in those bags, which again goes to an easier just what items aren't able to be in there, and then a preference for low sodium because we're talking non-perishable items. In those bags, they do have the tendency to potentially be high in sodium, and these are going to patients in the hospital. So the goal, yeah, we just ask for no pork and ideally low sodium items in there. There's also 2 types of bags that we receive in that area. We have a pantry bag that is able to be, you have full kitchen, you have cooking abilities, and then a ready to eat bag for folks that might be unhoused or not physically able to jump in the kitchen right after, being hospitalized. But that is back on our community health worker end of deciding what's, appropriate for those patients at those times. From a produce end, right, produce is generally fair game. We do ask for variety versus, especially for Veggies for Health, where they're getting produce every week and they're getting a box. We want to encourage them to use the full box. So we give Top Box a price limit per box and then ask for variety over quantity, so that we're exposing folks to a variety of produce within that budget. And then from the farm stand end, they don't need, people do ask, about organic certification or, what's used on those products. We don't necessarily require certification, but just an awareness of being able to speak to those products and just let folks know, what to expect with that produce. But the biggest is the low sodium and no pork in the patient bags.
Yeah, and then in the inpatient hospital setting, we're not only feeding patients, we're also feeding visitors and employees in our retail spaces. And while we have some restriction, of course, on our patient side with making sure that we're providing the prescribed diet that the physician has ordered for that patient, we are, cooking low fat, low sodium and using those types of cooking methods, but we're producing from scratch. So we're making, our chicken noodle soup from scratch, and we're able to then adjust the sodium content because we're not holding it for long periods of time. And so we're able to play around with seasoning. We are also playing around a lot with plant forward options and, rethinking the center of the plate, so to speak. Our meatloaf blend, for example, is a mushroom and beef blend, whereas before it was a beef and pork blend, and it's added, an umami taste to it with that mushroom blend, and added a lot more flavor. So playing around with those things to add flavor and decrease that sodium content.
Great. And we know that, we talked a little bit about some of the patient and flexibility of just the payment, but maybe you can talk about, how like these reliable payments are often make a big difference for small or minority-owned businesses. And if you could talk about how payment is typically handled for your vendors that are part of the program.
Okay, sorry. So I mentioned, right, becoming a vendor in our payment system and then receiving checks that way. We have been able to be a little bit flexible for the one-off events. So like those farmers markets or maybe Green Committee's doing an Earth Day event, where we partner with Jacobson Family Farms for the farmers market. And getting, we know that they're going to come out X amount of times throughout the summer. So doing an upfront invoice, we've had that established relationship. We trust that they'll be there. So we are able to do it pre-season, kind of front loading that if they want, or per market, paying them at the end of the markets. So been a little bit more flexible with those kind of one-off events. But for the Veggies for Health or the ongoing payments, we get invoices from them and send out checks that way.
Very
So-
similar process for Lori. It's just, I would just say we do the invoices on a monthly basis to try and get consistent payment going out the door. Sorry, go ahead, Eric.
I was just gonna say for us, we're typically working through either our primary, secondary distributor or the aggregator, and then they're turning around and paying the vendor. In some cases, we do have direct agreements with certain vendors, and in that case, they're set up through a contracting process. And while we do pay by check, we encourage them to set up ACH payment because it's so much faster. But there is definitely a lengthy process when it comes to setting up a new vendor.
I think that's all really helpful for vendors considering partnership with hospital institutions of like glimpse of, like how long the payment process and vendor partnerships can take. And maybe you can just share some upcoming local events or opportunities that vendors could engage in with your institutions.
We have one we're getting ready to launch with Jennifer and the West Side United team. So if you're not already a part of it, we've been convening a West Side United Food Equity collab, and this has been a variety of food organizations, community organizations, vendors, entrepreneurs meeting quarterly, sometimes in person, sometimes virtually, to go over whatever it might be. We've brought Unite Us to the table. We've brought different food aggregators to the table. It just kind of depends on what the group needs. But out of this collaborative, we're getting ready to launch a cohort for any vendors or food organizations that are interested in learning more about the 1115 Medicaid waiver that has been approved by the state. If you're not familiar, this is hopefully, we're watching, it's been approved. How things play out at the federal level is to be seen, but we're expecting in late 2026 or early 2027 that Medicaid will be able to start reimbursing for medically tailored groceries and medically tailored meals. So we want to get ahead of that and start working with different vendors on exploring, is this the right opportunity to be thinking about trying to contract with managed care organizations and get insurance reimbursement? Is there a better way to set this up and centralize and all work together with one billing entity? So we would love to connect with folks, understand questions people might have as we start to build out what that learning experience could be. If it's all technical assistance, is there training, is there capacity building? And then out of that, we're hoping to establish some contracts with local vendors where we can sort of be one of their first healthcare partners as a reference customer if they do decide that they want to try and contract directly with the MCO. So this will launch out of the West Side Food Collaborative that we run with Jennifer at West Side United, and I can put my info in the chat, but that's something we're really excited about and would love to engage folks on.
You want to go, Eric?
So at Rush, we actually, the supply chain department hosts a summit for local local businesses as an interest every year. Unfortunately, we just had it on the 28th of October. It's typically in the month of October. This was the second annual, and they look forward to having it again next year. Otherwise, I'm always engaged, either myself or one of my teammates, in going to a lot of the CivPAC events and the United events, as well as continuing to see what our Midwest partner and our common market aggregate partner offer. They also have events where they introduce and bring in new local vendors that we take a look at there as well.
For us, a little bit more one-off events. So I see the question in the chat from Pete too about doing the nutrition education or cooking demos around these products. My team, the community nutrition side of my team, we have a community wellness center where we run free nutrition classes for the community, including that's where Veggies for Health happens, but also community flavors, and Veggies for Health meetups where we bring back anybody who's completed the 8-week VeggieRx program can come back and learn how to tap into wellness through other community organizations. So would love to have local producers out to either of those community flavors. We bring in chefs or just, you know, anybody who wants to talk about their favorite dishes and cook a meal for our community. We purchase all of the food for those programs. And then for community flavors, whoever's leading that does get a small stipend to thank them for leading that. And then, like I said, the farmers markets, we do have the capacity to host year-round markets here in the hospital. So if anybody wants to set up a market, we can coordinate that as well. So a little bit more one-off events. And then similarly, did just close, but Endeavor has the Community Investment Fund. So from a funding end, this isn't necessarily getting producers into our you know, local procurement, but does support local vendors. But food access is always a focus of the SIF funds. And I am honestly a reviewer of those applications. So if anybody is thinking about applying for Endeavor's community investment funds, I am open to talking about that as well. But those applications did close recently, and I think we're in the final stages of this year's. But keep an eye out for all of that.
Thanks for sharing.
Weighing in on Pete's question as well on our end, I'll put it in the chat. So right now, the education that we provide through our family food program or food as medicine program is primarily directly texting patients resources that already exist. So it's a little bit of a busy page, but if you scroll to the kidney friendly section of our website, you'll see a bunch of different highlights. So this is the educational material that goes out with our kidney friendly boxes. These are the boxes for patients post kidney transplant. I think what we have found is just given the medical complexity of our patients, they either may not have a lot of time capacity or they may be trying to avoid events in person. And so we've done mostly like digital and virtual kind of education piece. But yeah, I think it's an important point, Pete, just making sure folks understand what to do with the boxes or how to maximize what's in the boxes, recognizing that in the way it's currently set up, it's sort of like a you get what you get. There's not a ton of individual choice within those boxes. We try and do our best tying out what we're putting in the boxes with the education we're providing.
And I dropped in the chat as well our wellness center schedule and where folks can sign up for classes.
And if anyone on the call has resources that you think could be helpful or you'd like to promote, feel free to send them our way. Our team would love to take a look and see if we can't feature them in something.
Right. Well, I think at this point, we wanted to just open the floor to any additional questions. So you can feel free to add them to the chat, or if you'd like to come off mute to ask your question around, you know, vendor partnerships, the procurement process, or any other questions around ways we can support local businesses.
All right, I see. I'm reading Pete's question. Yeah, so I'll share a little bit. So I will, on the insurance side, some is already actively happening. If you're not familiar with County Care's Food Smart, benefits. So county care members, which is one of the Medicaid plans in Cook County, all of them are eligible for a dietetic consult, and then they may also be eligible for some medically tailored groceries to be delivered to their homes. And I know they work with several of the local vendors, so that's already happening. And then 1115, it's a waiver process with Medicaid where states get federal approval to try new services within Medicaid and then be reimbursed for it. The goal of the waiver is always cost effectiveness. So the thinking is if we provide some steady nutrition and good food access to patients, can we lower healthcare costs over time, right? You can picture someone who has diabetes, maybe being able to avoid an expensive emergency department visit if we're able to control insulin levels with diet. And so this waiver, it's typically called 1115, is shorthand. And what's happened is we have the federal approval to start including nutrition supports in the waiver. And what we are waiting on is more guidance from the state on how that is going to work, right? Like who is eligible for the nutrition support? What are the diagnosis codes? Who can bill for it? Does it have to be a registered dietitian or can it be a community health worker? What's the reimbursement rate? Can education be a part of it? There's all these like implementation questions that we're still trying to work out with the state. I think there was a lot of great progress happening. Everyone's sort of taking a minute right now to understand how Medicaid is changing at the federal level, but what we are still hearing is that the state's intent is to go live with the waiver. I'll dig through my favorites, but I'll try and put HFS link about it in the chat. I know they are kind of doing like quarterly-ish town halls what the status of the waiver is. So yes, I don't know yet like what the reimbursement level will be, and what we're hearing from community food vendors in other states is it's a good fit for some, but not necessarily a good fit for all. And so we're trying to just bring some of that learning to food organizations in Chicago. So we're starting to get ready for it. So it's not just left to private corporations to capture the reimbursement. And then I hope that's helpful, Pete. Feel free to ask more questions. I don't know how much more I know, but I'll try. And then grant funding, I feel like that one's for you, maybe AK on the SIF funds.
Yeah, and then the internal, healthcare funding streams. So I guess SIF is, it's the Community Investment Fund, and I can drop the link to that as well. It is the Endeavor Health Fund, so you do have to be working within the service area, of at least one Endeavor Health hospital to be eligible for this funding. And there's capacity builder grants. It's ever evolving, I will say. Every year we're kind of tweaking how to best support our community through these funds, but the capacity builder and then the impact award was new this year. And food access is always a category for that. Same with access to healthcare, behavioral health, food and housing insecurity, and workforce development. I will say, especially right now, the focus of the applications that went, at least through I'm not a final, I'm a food access expert in the reviewing stages. But those, especially with the increased need for immediate food assistance, the awards that went through, or the applications that went through, we're looking to, get food into folks' hands immediately, directly. So those kind of programs are potential for funding. So the Food Connections Fund, the Food Connections program that I run at Swedish, which is our community nutrition team, and the food access work that we're doing, came out of the community health needs assessment in 2019, I believe, as just identifying healthy food access as a need of our community. And our internal hospital foundation supported creating this program. So has historically funded the program, which is amazing. So we are receiving internal funds through the Swedish Hospital Foundation, as well as federal, state, and private grants to support our work. So it's a little bit of a mix of funding, but has just remained a priority of the hospital, which has been extremely helpful in supporting the work and keeping it going. And then SIF is external. I hope that answered.
Maybe while we're waiting for another question to come through, I don't know, Stephanie or Eric, if you'd also want to speak to about, like where your funding sources are for these programs and, how you're securing and sustaining these partnerships through like funding resources to support the local vendors.
Sure. Yeah, ours all philanthropic. So I think process-wise, it's really helpful. I think AK, you were mentioning this on your institutional procurement side, just knowing partners, who's out there, what people are interested in, where there might be opportunity for collaboration. It's really helpful for our team to know that in advance of a grant application coming out. Or what I can do is if we hear something, learn something, if there's a project that's starting to crystallize, then being able to start looking for grants that are out there, share it with our foundation as well, who may know individual donors. So it can take a while to find that like perfect mix of funding and partnership, but my favorite is when it happens with a lot of planning and not sort of like scrambling because there's a grant deadline or something like that. So that's where these kind of events have been really helpful for us. And like AK mentioned, just being plugged into the scene, trying to work with different partners in ways that we can to put the partnerships together in ways that make sense, and then go find the philanthropy or the government contracts to make it happen. Currently, our family food programs are largely philanthropic. We'll be bringing some government funds online, hopefully in the next couple months here.
And for myself, we have an entire department, Office of Community Health Equity and Engagement, that handles that whole community outreach piece. That's not something that I do directly. The Food is Medicine program and the Rush in the Community. There's a wonderful manager, Julia Bassett, that handles those programs. Not within my necessary wheelhouse. I'm more in the inpatient hospital side. But for us, we're always looking for ways to reduce our waste, find savings there so that we can then reinvest that in maybe purchasing the little bit more expensive local chicken, for example, or the local apples. So always looking for ways that we can then move the needle that way.
I'll pause to see if there's any other questions people want to unmute to ask. Go ahead, Jonathan.
Thank you everyone for being a part of today's conversation. This is actually super helpful for me. My name is Jonathan Ostroff. I'm the founder of a product called Duo. Duo, kind of like what Erica was talking about with the meatloaf example, using half meat or half beef mixed with mushrooms. Our company is based here in Chicago, and we make blended meat products. So we use mushroom as the plant-based ingredient. So we have a beef and mushroom, turkey and mushroom, lamb and mushroom, and chicken and mushroom. No pork and mushroom, which I think AK was highlighting to not have as well. So that's also, and we don't really add salt, so it's also low sodium. But I've already have been in early conversations with Anthony at Topbox, and I guess my question is, in terms of protein, our products are raw. They need to be cooked, and that We can sell them in, retail packages that are, I have an example of one, but we have, retail packages that are for individual consumers, and this is what our product looks like for the, or we can do food service, in larger quantities. But my question, I guess, is in terms of the distribution, for all of you, would you prefer working with like a distributor like Topbox for this, or could we do like a direct distribution as one option? Thank you.
I can jump in. I think that Anthony had brought some of your product to one of our events and made meatballs, and everyone was raving about them. If my colleagues Megan's on the line, she can confirm or not confirm. But I think we were hearing very good things from the Topbox team, so that's awesome. Congrats on a great product. From the Lurie side, because we're filling medically tailored boxes, we will more than likely go with a vendor that can complete the box, and then hopefully they're contracting, right, with folks like Duo and other local vendors. But for us, we kind of need that wide variety of product to tailor the box. We don't have on-site, like any food storage facility. Our on-site pantries are all shelf stable, so it'd be pretty challenging for us to handle a product that wasn't food stable or shelf stable.
Yeah, I haven't seen it, but great product. And I would say kind of both, right? So for our more ongoing programs like the Veggies for Health, definitely partnering with Topbox is great, because they have the delivery system down, they have that communication down. They're very reliable with all of that. And then the one-off events, that could be kind of more direct partnership. So like if you wanted to showcase the product at a Community Flavors, we would love to have you come out and make meatballs and let everybody know about the product and kind of go that way. For our cupboards, we never really talked about price point in this conversation, but the cupboards, especially because our cupboards are pantries and they run on a no questions asked, take what you need, leave what you can system. And we have ones in the entry for the hospital that's hitting patients, visitors, people coming for appointments. And then the other is for employees, that's in employee health and just for our employees. So they're both pretty high traffic areas. So looking for kind of the biggest bang for our buck in those areas and getting things that we can get in bulk regularly. So for kind of specialty products, we do also heavily rely on donations for those. So most of our non-perishable items are coming from donations. We do purchase to supplement, especially with the perishable items, but kind of prefer to stock those with donations as much as possible. So any product that can be used as advertising or going close to out of date can go on the cupboards. But for regular partnerships and getting food out to patients, I would say partnering with Topbox or those established larger aggregates is extremely helpful. But there's always one-off, the farmers markets, the community nutrition events, a lot of opportunities there too.
Yeah, and then for us in the inpatient hospital setting, we really prefer to go through a distributor or an aggregator, especially when it comes to, a potentially hazardous food, a raw food that has to be cooked. There's just a lot more requirements that we personally would have to do with ensuring licensure and HACCP requirements and inspections that just become challenging for us to complete directly. Whereas when we work with a distributor, they're doing that legwork or that piece for us.
Yes, absolutely. And our product is always made in a USDA facility that's in the suburbs. So thank you for that, and I really appreciate everyone's answers and inputs. That's very helpful.
Thank you. Any other questions? Okay, we have a few minutes left. So maybe we could just talk a little or briefly about how your hospitals really got the buy-in to support some of these local efforts and strategies, for others on the call who might be working with institutions or ways they want to leverage their partnerships.
Want me to jump in? So I kind of said already with the community health needs assessment was where and that was yeah, I believe it was the 2019 one that first identified the need and got the institutional support that way. But also our green committee. So Swedish Hospital had our own green committee, and then now as a larger healthcare system, Endeavor Health also has one, where we're also part of the Good Foods Pledge as part of that committee. So having the buy-in from interest in, I guess, having that green committee, I was not there from the beginning, so I guess I don't necessarily know how it first originated. But looking for kind of those entry points into hospitals. Our local green committee kind of looked at more yeah, our local efforts. We started composting because of that. We have local lunch and learns, letting folks know about how they can be greener in their workplace and at home. But the Good Foods Pledge has really driven our local purchasing efforts as well.
And for Rush, it's really a part of our anchor mission, you know, hiring local, buying and sourcing local, investing local, and volunteering local. And we have wonderful support from Dr. Ansel and our CEO, Omar Latif, or Dr. Omar Latif. And they've been instrumental in helping us continue to support and move these programs forward.
The piece I would add for Lurie with our community health needs assessment, we look at where are kids living in the city. We look at something called the Childhood Opportunity Index. Where is this low? Where do kids have less opportunity? And then we square that off with where are we seeing volumes in our emergency department. And when we put all of those pieces together, the largest disparity we're seeing is on the west side when you look at low opportunity, lots of kids, and disproportionate volume in our ED. And so our overall focus is very much on the west side. And so our different community health teams that are working on a range of issues have all found different ways that what that looks like. And so while we're supporting a lot of folks and patients and community and organizations on the west side, we're also trying to spend the dollars that we do have on the west side as well. And so that's where we're trying to focus our procurement efforts more locally. It also includes the smaller things, so maybe they can add up when we're buying lunch or buying breakfast, trying to bring the local caterer into those spaces or community meals or events that we're having too. But I would underscore the CHNA. I think we're not the only healthcare folks in Chicago, and I think many of us have other counterparts at the other hospitals too. Chicago's hospitals, I think, are doing really great things in the food space. So taking a look at other institutions, CHNAs might tell you who else is very interested in food or where their focus might be too.
Great. We have any final burning questions or anything people wanted to ask before we end our session? Okay. Well, I'll just move to say thank you to our panelists, for sharing all your insights, your expertise. Thank you to everyone in the audience for your participation and questions that you've asked. It's really clear, local procurement's not just about shifting dollars, but building stronger communities, supporting local businesses, and creating economic impact. So we hope today's conversation gave you some practical ideas and inspiration of how to engage with these initiatives and hospital partners, whether you're a business owner, a partner, or community member. And thank you all for joining us and your continued support to make a more equitable food system.
Thank you. Extending that gratitude and appreciation for, again, our moderator and our panelists. Thank you all for attending